Hi, everyone. My name is Yunshi Wilson, guest correspondent here at the Pure Lab Health event with MedEdge MEA. And I have with me Dr. Aaron, ASA MedLab. So we're going to go ahead and jump right into the questions because your specialty is in digital pathology, correct? So I have a question specially crafted for you. How has digital pathology revolutionized diagnostic procedures in medical labs?
Great question, Yongchi. So pathologists usually are the ones that make the diagnosis that typically leads to 70% or more of the clinical decisions that are made.
Okay.
Some of the decisions immediately lead to treatment, so especially in the cancer setting. Other ones may lead to additional tests that need to be done.
Okay.
So when you have a digital image that can be shared across many different platforms, so there's the collaboration among the different specialties with the doctors, with radiologists, with the treating physician. One way to think of it also is that now we have a common document. One of the phrases we use is either a common source of truth or the ground truth. So there's just a single document.
Right.
If somebody has a question, they can put a little circle and say, well, can you explain to me, the oncologist may say, explain to me what this is. Or the radiologist will say, well, this is what you see, but this is what we saw in the imaging. How do you put those two together?
Right.
So these are some new ways that we can look at and collaborate and have a discussion that really ultimately benefits the patient.
Well, that's perfect because then that brings me to my next question, which is how do labs ensure that patients understand their tests accurately?
Okay. So that, again, it comes down to communication.
Okay.
Now, today's patient has so much information at their fingertips. They're very savvy. Usually by the time they've come to our facility, and I've practiced in several of the leading facilities in the UAE, let's say they have a new cancer diagnosis. They've been to the other cancer hospitals. They know exactly what everyone else has said. They know also what Google says about their condition. So when they ask a question, they're actually trying to test us.
Yep.
So one of the things actually we need to do is not only be prepared, but to tell them and explain. Usually there are details of the report that they have questions about.
Right.
We need to put it in a way that makes sense to them.
Right.
Usually they want to know the diagnosis. Typically for most people, it's either black or white, yes or no, I have cancer or not. But there are gray areas in which you have a precancerous condition. You may have a risk for a cancer, but you don't have the full-fledged cancer.
Right.
But what the most important part is many pathologists shy away from that patient interaction. Some of us have chosen pathology because we don't want to interact with patients. I actually like to interact with patients. So there are pathologists now that actually hold office hours. So patients can come in with their report, they ask their questions to the pathologist, and I'm a little cheeky. I tell people the last time I checked, I have an MD after my name. I am qualified to talk to patients and other people.
I love that. I love that response, which then leads to talking about qualifications.
Sure.
What qualifications are most important for a career in medical laboratory science?
Great question. So there you have to go through the training.
Okay.
So you have to get the degree, the med tech training, medical science. And I usually like to use the word medical lab scientist, MLS. So they're not just technicians. They're not just people who are presenting a tube in front of a machine.
Right.
It doesn't take much intelligence or effort to make that happen. So especially as AI becomes a bigger part of our practice, people have to have a scientific mind. They have to have the right training. They have to have an inquiring mind.
Right.
We have to continuously be educated. So continuing education is a big part of our field. Curiosity, tenacity, resilience, those are all part of what goes into a successful career.
That's wonderful. You are so precise as a senior. Amazing.
Thank you. That's very kind.
Yeah, well, thank you so much for your time. Those are all the questions that I had.
Good luck.
All right, thanks.